Bariatric surgery for significant obesity often improves type 2 diabetes. In fact, studies are showing that in some patients, bariatric surgery may even put diabetes into remission.
On this week's Health Talk, bariatric surgeon Dr. Neil Flock will discuss the potential health benefits of weight loss surgery beyond the scale.
So stay tuned, we're up next. Hello, I'm Dr. Eric Baser.
And I'm Dr. Andrea Peterson. Our topic today is diabetes and weight loss surgery. Our guest is Dr. Neil Flock. He's the medical director of the Norwalk Hospital Surgical Weight Loss Center.
Thanks for joining us, Neil. It's so good
Welcome
to have
back.
you.
Pleasure to be here. Pleasure to be here.
A very important topic today.
And exciting.
And exciting. We're going to talk, we were talking before, today we understand that obesity is not just a cosmetic problem, is it?
It's not a cosmetic problem at all. In fact, this is a severe medical problem. It's one of the epidemics of our global society. Along with diabetes, obesity is killing people. It is something that we have lost control of. And especially the medical problems associated with obesity are really affecting people. So obese people with diabetes is a tremendous problem, not only here in the United States, and even, but more even in other societies. For instance, India. We know Indians and people in Asia get diabetes much faster than the genetics of people in Western society. So it's affecting us all on a global basis.
Tell us a little bit more about, in addition to diabetes, what some of the health consequences of obesity are.
Wow, that would take a long time. So I'll just start with sleep apnea, thyroid disease, cancers, 13 different cancers are significantly associated with it. Everything from gallbladder disease to trauma to falling down to bone problems to issues that really hit just about every medical specialty. It really has a very wide range. And in fact, one of the greatest things we could do to help the health of this nation and the world is to tackle obesity and to fix the problem.
I think that's so important because I think not everyone understands always the extent to which obesity really impacts health. And certainly when you have a problem like diabetes or sleep apnea, being obese with it also makes those problems harder to manage and harder to control, doesn't it?
Yes, I mean, certainly there are many diabetics out there who are not obese, but one of the issues is when you have obesity and diabetes together, is it the obesity that's contributing to the diabetes? And the answer is yes. So let's treat the obesity. And if we focus on that, then we're also focusing on that medical problem, whether it's diabetes or one of the other ones. Now, specifically, the surgery that I do actually independently does things to improve the diabetes beyond the weight loss. Okay? So studies show initially losing the weight right after surgery helps the diabetes, but long-term effects of the diabetes are something that is special to these surgeries.
Which is really sort of amazing. I don't think anybody anticipated this at the dawn of weight loss surgery. Maybe you could say a little bit about the pathophysiology. How is obesity connected to diabetes? And then how does your surgery change that? I shouldn't say your surgery, but weight loss surgery change that.
Well, you overwhelm the pancreas with whether sugar or carbohydrates, and you stimulate, and the need for insulin goes up, and the amount of sugar that we take in goes higher and higher, and as does the insulin, and then all of a sudden, boom, the sugar keeps going up and insulin goes down, and people get diabetes. So we
Because
can't
fat actually
keep,
makes you resistant to insulin, doesn't it?
Yes, it can. And that's one of the issues. But most recently, we've been seeing that sugar and the amount of sugar in our foods, I think, is contributing the most to it. We've decreased our fat in the 1980s because of dietary changes, but we substituted that by increasing carbohydrates, and that was a big problem. We realized that fat wasn't as bad. So a lot of the studies that came out where both fat and carbohydrate are bad, but we change the fat, not the carbohydrate.
And are simple carbohydrates that cause a higher spike in blood sugar worse than complex carbohydrates?
Complex carbohydrates, very complex carbohydrates, are very good because they've got fiber in them. And something like broccoli is a complex carbohydrate. That's a healthy food. But the simplest carbohydrate is sugar. And then you get a little more complex and you get into carbohydrates like pasta and bread and corn and potato and the starches, which are not very good. So they're good foods in all the different foods.
You just listed what I really like to eat. Bread, pasta.
Everybody likes to eat it because you know what? It signals your brain to eat more of it. And it gives you a pleasure. The sugar gives us pleasure like a drug. And people are addicted to the food. Now where the surgery comes in is it tends to reverse all these problems. And the studies have shown that at 1 year, 82% of former diabetics, if you take all of them, 82% of them have a normal blood sugar and off all their medications.
That's amazing.
That's extraordinary.
Yeah,
Which
is extraordinary. That's 1 year. Now 10 years, 50% of all diabetics across the board, the worst diabetic, maybe a simple diabetic who's obese, 50% of them will still remain off their medications and have a normal blood sugar. So it's pretty much a 50% remission rate at 10 years.
Is there data to compare that to what happens to people who lose weight without surgery?
Yes, very interesting. So there is a benefit of the surgery which is extremely strong. If you are that same person and you lose the weight on your own, will you just, be in remission? What's that likelihood? Well, it's significantly better if you have the surgery. And it's hard to compare because, people at 10 years who are diabetic losing the weight, there aren't that many of those people.
It's very difficult for people.
It's very difficult. Mm-hmm. So if you are, for instance, if you are diabetic and you're on insulin, it's very difficult to lose weight if you're obese. But now you're obese, you're diabetic, and you're on insulin, which is a drug that pushes the sugar back into your cells. It's almost impossible. So we don't know that. I can't answer that completely because of that. But we know that surgery works. And now it's to the point where all the many medical associations across the globe have joined the surgical associations in recommending as part of the treatment algorithm bariatric or weight loss surgery, or metabolic surgery is what we should call it, because we're treating a metabolic disease with a surgery.
So we started doing bariatric surgery with a very simple concept, and that was you'll make the stomach smaller so people can eat less. But it turns out to have a much more complex effect on the body, which is beneficial. And maybe you could talk a little bit about that.
Yes, when we talk about obesity and the surgery and its effects and how it works to treat obesity, we talk about changing the bile acids and altering the hormones that affect hunger, and also changing the bacteria in the gut. When we talk specifically about diabetes, there's a hormone called GLP-1, glucagon-like, phosphate 1, and that is actually the drug that's in metformin, which is the first-line drug that people are given to treat diabetes. Well, what these surgeries do, the sleeve gastrectomy surgery and the gastric bypass surgeries, they stimulate that hormone. So it's a natural way of increasing that amount and staving off, stopping, resolving the diabetes. Now also with the surgery, you do the other things as I mentioned above. But changing those hormones is just an incredible thing that this surgery brings to us.
Now, not everyone is a great candidate for bariatric surgery, are they? And how do you help people navigate their choices?
Well, they're better candidates than others. But the problem is if you reach that weight, and the issue that I have as a physician, if your BMI is 35 and above and you have a medical problem or you have diabetes, and I know that the most effective way of resolving your diabetes is surgery, you may not be as good a candidate as the next person, but you're still a candidate. And I think I've changed the most in the past 5 or 10 years to think of everybody as a potential candidate. How can I get you to become a candidate? How can we maybe change your thinking, make sure that you'll be more compliant? So everyone is potentially a candidate when they reach that weight. And certainly there's certain things you have to be, there's certain no's that we don't do. Some patients who are using drugs or smoking or have certain medical issues may not be candidates, but we try to help all people and not be exclusive of certain people.
We have about a minute and a half left, and we've been talking about bariatric surgery. Maybe you could say a little bit about what do they do? What, you've got a minute and a half.
Well,
take the sleeve gastrectomy. How long is the recovery? How much pain is there?
It's much less than it was before, and the mortality from this surgery is cut in half in the past 10 years. So people come into the hospital, it's 5 incisions, you're completely asleep, the operation takes about an hour. We measure appropriately the amount of stomach to remove, and patients may or may not have a drain anymore. They get an x-ray post-operatively. They do have some nausea afterwards, you do have a certain amount of pain, but after a day in the hospital, 24 hours or even less, you're able to go home. Back to work in about a week. Depending upon your job. So it really is tremendous what we've done. It's a cost savings to our society, it's helpful to people, and we're also learning about how to treat obesity and the effects of it from the surgery.
And you need a cooperative patient, don't you?
You do.
It's not magic.
You have to be responsible, and that's why we give seminars and we try to educate patients about the surgery, what to expect. You need to follow up. You need to follow up forever with your doctor, at least once a year. But in the first 2 years, it's once every 3 months. And you should see your bariatric surgeon or a bariatric specialist.
And I think it's important to point out, this is a whole program people get
It's a
involved
team.
in. And it's a team. It's not just simply a surgeon doing an operation.
And we start the program without surgery. And we move up for those people who really need it.
That's wonderful. Wonderful information. Thank you so much for joining us and sharing everything with our viewers.
Unfortunately, that's all the time we have for today. So please send us your questions and comments to healthtalk@wchn.org. Andrew and I love to hear from you.
We'd like to thank our guest today, Dr. Neil Flock, for joining us on Health Talk.
Neil, thanks for joining.
Thank you.